Hello everyone, welcome to Students Point. Recently, central government has appointed Suresh Chandra Sharma as the first chairman of National Medical Council. So, National Medical Council Act 2019 has again become a topic of discussion. So, we will see what is the act, what does the act provides for, what changes acts brings in, and why it was necessary, and the criticism related to NMC Act 2019. NMC Act 2019 received President assent in August 2019 and it aimed to improve access to quality and affordable medical education and to ensure the availability of adequate and high quality medical professionals all over the country. So, what were the changes brought by NMC Act 2019? So, firstly, it annulled the Indian Medical Council Act 1956 and it set up a new medical council in place of Medical Council of India. Medical Council of India, which was erstwhile regulator of Indian medical education. So now NMC regulates the Indian medical education and the profession and institutions. So it also provided that NMC will have power to regulate fees, which earlier MCI did not have. It also provided in clause 15 for exit test, next, which is called next, national exit test. So there will be an exit test for MBBS, and anyone who wants to get license to practice, they have to go through the next exam. It also provided that there shall be community health providers. This group of community health providers shall help us to tackle the problem of inadequacy of doctors. It also provided for the composition of National Medical Commission. So NMC shall have a chairperson. Recently Suresh Chandra Mathur was appointed as chairperson, and it shall have 10 ex officio members and 22 part-time members. So why was there need to pass such an act? Because MCI, which was erstwhile regulator of medical education in India, failed in its task of producing adequate number of doctors as well as efficient doctors. Because the prime role of MCI was to generate and produce such efficient number of doctors in India. But when we see the scenario in India, it is quite poor. For instance, India has a doctor population of around 1:1456. That is to say that there is only one doctor for 1456 people, which is much poor if we compare it with WHO standard, which is 1:1000 person only. So India lags much behind. Also, there is a huge distribution gap between urban and rural areas. For instance, in urban areas, if a certain population has 3.8 doctor, the same population in rural area shall have only one doctor. So such is a scenario. There are also charges of unethical practices and unaccountability on the part of Medical Council of India. MCI was alleged of corruption, and that is why in 2016 Supreme Court directed Government of India to set up a committee with the authority to oversee all the statutory functions of MCI, which central government did so. Till 2018, that committee worked for MCI, and after the law was passed, that committee was abolished and the law created NMC, which now is functioning the role of MCI. Also, we have noticed that countries like Thailand, UK, China, and even cities like New York have permitted community health workers, which are working very well at the mid level and are reaping very good results. So, NMC Act 2019 also envisaged to create a community of community health providers. They will work at the mid level so that we don't face the problem of inadequacy of doctors, primarily for the primary health cares. But still there are lots of criticism about the NMC Act 2019. So let's see what are these criticism. Doctors say that the act is anti-poor and anti-student. Why it is so? Because they say that it is anti-poor because it has provided for provision of next exam, that is national eligibility test. Earlier students were not required to give this next exam, but now if they want to practice, they want to get license to practice, and even they want to take admission into PG, they have to go through this next exam. This will be applicable throughout the country. And also, if a foreigner student is coming to India and want to practice in India, they have also have to go through this exam. So it is a major concern, and for this the act has been criticized. Also, it is not clear yet as to what kind of professional could be certified as central health providers. Also, clause 10 of NMC Act 2019 provides that NMC shall regulate fee of 50% private medical college seats. So at present around 50% of MBBS seat is in government college or central government colleges. So now when NMC Act is providing that 50% of medical college seats shall be regulated by NMC, so it makes it 75%. So fee of 75% seats shall be regulated by NMC. So this is also not appreciated by critics. And doctors also say that this act allows central government to override any suggestions of NMC. And erstwhile MCI did not have the power to regulate fees of private medical colleges. So this is also a concern. If you find the video useful, press the like button and subscribe to our channel and press the bell icon so that you don't miss any important videos. Till then, thanks a lot.